Welcome, everyone, for joining us today. My name is Holly Lopez, and I work with San Francisco Health Service System. Thank you for joining the webinar today for the General Medicare Plan Benefits Overview for Medicare retirees. We have representatives today from our health plans with us who will be able to answer your questions throughout the Q&A comment section on the webinar. And your microphones are going to be muted during the entire webinar, but we really encourage you to ask those questions through the Q&A channel in the menu bar. It's going to be active throughout the entire session, so you can start clicking in. And it's actually helpful if someone were to click in and say, "You can hear me now," just so that we can see that that's active and working. At the end, we're going to have a presentation of the plan benefits. And at the end of those presentations from both the plans, you'll be able to hear each of our representatives answer our questions that are coming through the channel. And we also have SFHSS staff who will be answering any administrative focused questions. So with that, I can see a thumbs up coming through that we're active and engaged. So I'm going to start off. Welcome to the San Francisco Health Service System Open Enrollment Webinar. We're so glad you've joined us today to learn about your benefits for Plan Year 2026. Open enrollment is a period each year when all members can enroll in benefits coverage and change their current benefits coverage for the upcoming calendar year. You can change from one plan to another, enroll or waive coverage, add remove dependents from coverage, enroll in flexible spending accounts. If you do nothing, your current year benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts each year to participate. Your new benefit choices are effective January 1st, 2026. Open enrollment starts at 8 a.m. on Wednesday, October 1st, 2025, and ends at 5 p.m. on Friday, October 25th, 2025. You may enroll online through SF My Hub, located at sfhss.org. How to enroll. Find the open enrollment tile to access the My Health benefits to make your new benefit elections. City and county employees can also access SF My Hub through the SF My portal. Paper applications must be postmarked by October 24th, 2025 to be accepted. You'll be on mute and off camera for the entire presentation. We encourage you to ask questions. We will be using the Q&A function in Microsoft Teams. Scroll through your screen to find the menu bar, either at the top or bottom of the screen, depending on whether you're using your computer or mobile device. Click on the Q&A icon in your menu bar. Click on Create Post to type your question. We will answer as many questions as time allows during the Q&A session. Please do not share personal medical information in the chat. Everyone can see it. We recommend a one-on-one consultation. If you have questions that do include personal and private medical information, please schedule a private one-on-one consultation with a health plan vendor. Our health plan vendors have open enrollment office hours. To schedule an appointment, visit sfhss.org/OE2026. If you have eligibility questions, please call SFHSS Member Services at 628-652-4700 or visit our offices at 1145 Market Street, the third floor, during our business hours listed on the screen for further assistance. And we want to remind everyone to get their annual flu shot and COVID booster to protect yourself and your loved ones this fall and winter. With that, our presentation will now begin.
Good afternoon, and thank you for joining today. In this presentation, we will be going over, at a high level, the Blue Shield Medicare PPO plan available to San Francisco Health Service System members, effective January 1, 2026. Blue Shield Medicare offers comprehensive medical and Part D prescription drug coverage with the freedom and flexibility to access care nationwide from both in-network and out-of-network providers. This plan is a good fit if you prefer to self-refer to specialists and see both in-network and out-of-network providers. Plan highlights to take note of include no or low copayment for most Medicare-covered services, access to virtual health care with teledoc doctors, and coverage for medical care across the United States, including urgent and emergency care anywhere in the world. Blue Shield Medicare gives you flexibility and choice. You can choose to receive care from Blue Shield Medicare in-network providers. This option allows you to pay your coverage copay, and the provider will bill us directly for covered services. Or you can choose to receive care from out-of-network providers that participate in Medicare and are willing to treat you. Here are some helpful tips before seeking care from out-of-network providers. Check with your provider before receiving services to confirm that they participate in Medicare. If you receive care from a provider who does not participate in Medicare, you will be responsible for the full cost of the services received. You don't need to get a referral or prior authorization when you get care from out-of-network providers. However, before getting services from out-of-network providers, confirm the services you are getting are covered and medically necessary. It is best to ask an out-of-network provider to bill the plan first. But if you have already paid for the covered services, we will reimburse you for our share of the cost of covered services. Or if an out-of-network provider sends you a bill that you think we should pay, you can send it to us for payment. As you can see on this chart, your Blue Shield Medicare plan gives you the flexibility and choice to not only see in-network doctors and healthcare providers, but also out-of-network doctors and providers at the same cost share as long as they participate in Medicare and bill Blue Shield of California. Blue Shield Medicare gives you access to pharmacies that offer preferred cost sharing across the United States. Major pharmacy locations include Albertsons, Costco, CVS Pharmacy at Target, Safeway, Vons, and Walmart, where you can receive a 3-month supply for 2 months' worth of copay for most drugs. Please note, members don't need to be a Costco member in order to obtain covered prescription benefits there. You may also have your maintenance medication delivered to your home or office at no charge for shipping. Signing up for home delivery pharmacy saves you a copay. Receive a 100-day supply for the cost of a 2-month supply of covered maintenance medication. To find a network pharmacy near you, or for more information on formularies and home delivery prescriptions, visit our website at blueshieldca.com/SFHSS. Blue Shield Medicare provides coverage for routine acupuncture and chiropractic care at a $15 copay per visit for up to 24 visits per benefit category per calendar year. These are non-Medicare covered services. No need to see your primary care physician for access. You can self-refer to any chiropractor or acupuncturist in the American Specialty Health Plans of California network. To find a chiropractic or acupuncture provider, go to blueshieldca.com/find-a-doctor. For out-of-state acupuncture or chiropractic services, call Blue Shield Medicare's dedicated customer service team for assistance at 1-800-370-8852. Your Blue Shield PPO Medicare plan membership comes with additional benefits: vision coverage, transportation for non-emergency medical appointments, personal emergency response systems that keep you connected to your caregiver network, complimentary gym membership with the Silver Sneaker Fitness program, and at-home meal delivery service to help with your recovery after being discharged from inpatient care. Accessing these services is easy. Just call our dedicated customer service line at 800-370-8852. We're open 7 days a week from 8 a.m. to 8 p.m. Pacific Time. Getting answers to your urgent questions has never been easier. The Blue Shield Medicare SFHSS website gives you 24/7 access to health plan information. With only a few clicks, you can get an overview of your Blue Shield Medicare plan, find in-network doctors, download plan documents, and get details on some of the benefits like emergency and urgent care around the world, preventive care coverage, and 24/7 virtual care with Teledoc, and so much more. Members will have direct access to Blue Shield Medicare's dedicated customer service team to answer any questions members may have regarding their plan. Additionally, The highly skilled Care Navigator team is here to help with scheduling appointments and care coordination. Members receive dedicated support from the pharmacy technicians on any pharmacy or formulary questions. Thank you for watching the Blue Shield Medicare PPO Plan overview video.
Hello and welcome. To find your healthy place, you and your family need high-quality care that is simple and personalized. At Kaiser Permanente, we're both a care provider and a health plan which makes your life easier. Today, I'll be highlighting our integrated quality care, digital care options, and membership perks. This shared information will help you select with confidence the right health plan for you and your family. Before we start, please tell us what you think. We invite you to complete a 2-question survey at the end of the presentation, which will take less than a minute to complete. Now, are you ready to get started? Great, let's begin. Kaiser Permanente provides high-quality care designed for your total health. That includes care for routine checkups, complex treatments, and mental wellness, and care for building strength, reducing stress, raising a family, and new goals. No matter what your priority is, ours is providing excellent care when and where you need it. We can help you get to your healthy place no matter where it is. We combine care and coverage, which makes us different than your healthcare options and gives you peace of mind. With us, you get connected care. What this means is your doctors, pharmacy, and lab are connected to each other and to you. Through our electronic health record, they can see your health history such as your conditions, medications, and allergies, making it more convenient for you to get the right care when you need it. At most of our facilities, you can see your doctor, get a lab test or an x-ray, and pick up prescriptions, all without leaving the building, making your care feel easier, faster, and centered around you. Kaiser Permanente doctors have one priority: your health. Your personal doctor is your best health advocate. They coordinate your care with a multidisciplinary care team and make your health their top priority. Our doctors and caregivers reflect the diverse communities we serve and provide culturally responsive care in many different languages. Your care team also uses your electronic health record to help you schedule checkups and tests. When you need care, you can talk to a clinician in person, over the phone, or by video. Same day, next day, and weekend appointments are available at most locations. You can also get advice 24/7 over the phone and online through an e-visit at no cost, saving you time and money. Telehealth services are not an add-on at Kaiser Permanente. They're covered at no additional cost by most plans and have been a part of how we deliver personalized care. If you prefer to visit us in person, it's easy to schedule an appointment at a location near you. No matter where you are, your Kaiser Permanente care team can see your medical history on your electronic health record, so you never have to repeat your story. And because services are connected, many Kaiser Permanente facilities have pharmacies, labs, and other services all in the same building, so you can get more done in fewer stops. It's easy to refill prescriptions in person, over the phone, online, or on the Kaiser Permanente app. You can have most delivered to your home with same-day or next-day delivery, or order your prescriptions for same-day pickup. Get refill reminders or alerts when new prescriptions are available to order via text, mobile app notifications, or email. You can also place some orders by responding directly to our text message reminders. We'll provide status updates via text or email about shipping, delivery, or pickup information. Since keeping you safe and healthy is our priority, you're covered for emergency and urgent care anywhere in the world. You can also get urgent care at Minute Clinics located in select CVS and Target stores, the Little Clinic locations, or Concentra Urgent Care Centers when traveling outside a Kaiser Permanente area. If you seek urgent care at a Minute Clinic, the Little Clinic, or Concentra Urgent Care Center in a state where Kaiser Permanente is located but are outside one of our service areas, you'll be asked to pay upfront for services and need to file a claim for reimbursement. To make getting care while traveling more convenient, there's the Away from Home travel line available 24 hours a day, 7 days a week. kp.org/travel is a special section of our website that's focused on getting care while traveling, and you'll have the ability to refill eligible prescriptions early in preparation for travel. Your mind and body are connected. What you think, feel, and do affects your total health, and we are committed to caring for the whole you. We provide clinical and support services for a wide range of conditions. from stress and anxiety to drug dependence and autism spectrum disorders. Our mental health includes psychiatrists, psychologists, as well as family therapists, licensed clinical social workers, and addiction medicine physicians. And as a Kaiser Permanente member, you don't need a referral for mental health care. We also provide members with tools and resources to process self-care like guided meditation and wellness apps. Now let's see how we are using technology to give you more convenient ways to get care. Now let's go into more details about the Kaiser Permanente plan options available to you, including high-level coverage amounts. You can choose from the following medical plan options. Now let's take a closer look at the high-level coverage amounts of your plan options. For specific information about your covered health plan benefits, limitations, and exclusions, please review your evidence of coverage or speak to your benefits administrator. If you need additional time to review this information, press the pause button in the lower left-hand corner of the screen at any time. Here is an overview of the plan option being offered to you. Chiropractic and acupuncture care services are also included. These services are covered when provided by an American Specialty Health Plan participating provider. You can obtain chiropractic and acupuncture services without a referral from a plan physician. Call or visit the website on the screen to find a participating provider near you. Get fresh, nutritious meals delivered to your home at no charge. As a Kaiser Permanente Medicare Health Plan member, you can get fresh, healthy meals delivered to your home immediately following an inpatient stay at a planned hospital or skilled nursing facility. OnePass can help you find a fitness routine that's right for you, whether you work out at home or at the gym, and it's available at no extra cost. Need a ride to the doctor? Your plan covers that. You can get a ride to and from your doctor visits at no charge up to 24 one-way trips or 50 miles per trip per calendar year. You can sign up through your benefits administrator over the phone with a Kaiser Permanente enrollment specialist, or by entering some basic personal information at kp.org/choosekp. After you sign up, we'll reach out to help make your enrollment as easy as possible. We can help you transition your care, easily move prescriptions so your treatment is uninterrupted, and find a care location that's close to your home, work, or school. You can choose your new doctor, browse doctors by location, and see details about their education, specialties, languages spoken, and more online. Choose your doctor based on what's important to you and change it anytime. Within 10 days of your start date, you'll get a personalized welcome book in the mail, a welcome call from us, and your ID cards. And once you make your first appointment, you'll get a pre-visit call. Thank you for your time and attention. Today we reviewed our integrated quality care, digital care options, and membership perks. Please visit kp.org to learn more. Now you have the information you need to select with confidence Kaiser Permanente as your health plan.
Thank you, everyone. That ends the presentation portion of our session today, and we can begin our Q&A portion. So I'd like to welcome all of our vendors and our HSS staff to turn their cameras on so we can see who's providing all of our answers. And I can remind all of our members joining and members from the public that they can type their questions into the Q&A channel. And those questions will start popping in. Comments will be written in, but I'm also going to read all the questions out loud and then welcome our plan reps and staff to answer them individually. And just as a reminder, this is not a forum to share any personal medical information. It's public. It's going to be shared on our website. So things like DSW numbers or Social Securities are protected and are not needed here to answer any questions. So refrain from entering those in. And then the webinar is going to end promptly at the top of the hour, and we'll give like a 5-minute warning when we know we're wrapping up our last question so that we can gauge how much time we have left. So I'm going to scroll down to the first question, and that is from Irene. Irene says, I'm turning 65 in January next year. Well, that'll be 2026. How do I apply for Medicare during the government shutdown? And what will happen to my insurance next year if government is shut down at that time? So this may be this question. We have Jessica Shi and Sonali Sonoy on the line. if there's any guidance we can provide. So Sonali, we'll let you unmute.
Sorry, I was focusing on another question. Can you repeat that question for me if you don't mind?
Yeah, it's a retirement question on how to apply for Medicare during the government shutdown, how that affects the SF government and our benefits, and then what will happen if my insurance next year, if the government is still shut down.
I will have to look into that, and I'll have to. I at this point we don't have any guidance on that on government shutdown. But as far as HSS goes, we require anybody who's applying who is 65 and is a retiree to be enrolled in Medicare Part A and Part B. So we recommend that they apply 3 months in advance. So there is a processing time that the Medicare has, and provide us the copy of the Medicare card or the award letter at least a month in advance so that we can transition them into the Medicare plan.
Okay, thanks, Sonali. And I can see Julie from Kaiser Permanente may be able to supplement some information.
Yeah, I just wanted to say that as we do know that parts of the government are shut down. As far as we understand, Social Security and Medicare, they might be working with more limited staff, but you should not stop anything that you would normally do. We would encourage you as soon as you're able to enroll in Medicare when your initial enrollment period opens up, do that right away. There might be short delays, but we don't expect it to have any impact to your enrollment.
Okay, thank you, Julie.
Yep.
All right, we'll move on to our next question, which is coming in from Patrick Sullivan. Patrick says, I'm retired from SF Fire Department. I'll be 65 in April 2026. I currently have Kaiser Health Insurance through HSS. And Patrick's going to share a little bit more information, which I'm not sure we'd be able to answer. It could be very personalized, but my wife works for Kaiser and is going to work for several more years. I am eligible to be on her health plan. I have read that I will need to register for Medicare Part A when I'm 65, but I will not be required to register for Medicare Part B as long as my wife continues to work and I'm covered under her plan provided by her employer. So Patrick's wondering if this is correct, and if so, what does he need to do once his wife retires and is no longer having her medical coverage?
So this is Julie from Kaiser. I'll take the first part. If you are going to be receiving your health benefits through your wife, who's an employee of Kaiser Permanente, you are not required to enroll in Medicare. Once she is getting ready to retire, since there are different actual companies within Kaiser Permanente, and her health coverage in retirement could differ based on her role, which organization she worked for, how many years she worked for Kaiser. I would encourage your wife to reach out to her Kaiser benefits team to find out what the process is if you're going to continue her under her health benefits in retirement.
Okay, that was a Kaiser specific one, so thank you, Julie.
Sure.
We'll move on to Rick Cheney Jr. Rick says, I plan to retire when I'm 65 years old in July of 2029. I will have 12 years of service with the city and county of San Francisco at that time. I'll apply for Medicare at that time. My wife is 6 years younger than me, so she will be 61 when I retire. So the question is, will my 50% retiree health benefit cover my wife for the 4-year bridge until she reaches age of 65, and then she can apply for Medicare? And then another question is, once we are all both on Medicare, do we still get any benefit from the SF 50% health benefit?
So I'll take that, Holly.
Thank you, Sonali.
So when the member retires, they're eligible for, if they're saying 50%, that needs to be validated and confirmed. So I'll highly recommend that they consult with our staff here at SFHSS. However, going back to the question, if they're retiring, them and any eligible dependents are can apply for benefits. And then when they if they are Medicare eligible, then their dependents will be in an HMO plan, in a traditional HMO plan, or a PPO plan if they prefer to be in Blue Shield. And when the dependent, let's say the spouse, is Medicare eligible, they will transition onto the Medicare plan.
Okay. Uh, Thank you, Sonali. We're going to move on to the next question, which is from Irene. Could you provide a list of gyms in SF covered under Silver Sneaker? So that could go to both
That comes
both
to
for
me.
Hamilton. Okay.
So for Silver Sneakers, the list can change and it varies by where you reside. So to get the best and most accurate list of providers or of gyms in your area, you can call directly to Silver Sneakers. I did put the phone number in the comments. It's 1-888-423-4632. Their hours are 5 a.m. to 5 p.m. Pacific time. Or you can contact our dedicated customer service phone number of 800-370-8852. And they're open from 8 a.m. to 8 p.m. Pacific time. And then on our website, the blueshieldca.com forward slash SFHSS, once you choose the Medicare side, about just slide down a little bit, you'll see a link to Silver Sneakers, and you can go ahead and search for providers there too. It'll give you a list. You can put your zip codes in, and it'll tell you what gyms do accept insurance.
Okay. Thanks, Laura. Our next question comes from Roban San Miguel, and Roban is asking, please provide the Blue Shield contact number that was mentioned in the presentation. And Laura, you commented, could you read that out loud again, just to everyone here?
Certainly. That is going to be the 370, or I'm so sorry, 800-370-8852. And I did put that in the comment too, so if you need to write it down.
Great. Thank you, Laura. The next question comes from Catherine Cheng Orban. I'm 75 years old. I'm a retiree. My husband is in the Air Force veteran, and we have TRICARE. Do I still need to have Medicare insurance from SF healthcare system? Knowing that, let's see, Catherine's saying they live in Las Vegas, so Kaiser is not helpful. My TRICARE coverage is medical and dental. This might be some a specific question. Sonali, I'm not sure if we can answer this, or this may need a little more personalized consultation.
Yes, I'd recommend, I'll highly encourage the member to consult with us.
Okay, and how can they do that?
They can either call us or come to our front office. Our phones are open from 9 to 12, and 1 to 4:30. Our front offices are open from 9 to 4:30, and on Thursdays we open at 10.
Okay, thank you so much. All right, the next question is coming from Mataza. Can you reshare or share the phone number for out-of-state chiropractic and acupuncture with Blue Shield? So that question is for Laura.
Certainly. I did just comment that phone number with the times. It's 1-800-678-9133, and they're open from 5 a.m. to 8 p.m. Pacific time, and that would be the phone number for ASH.
And can you remind us what ASH stands for?
American Specialty Healthcare.
Great, which will cover the acupuncture.
The routine, yep.
Okay, great, thank you. And Catherine is adding another question. Do I still have to have SF health insurance if I have that TRICARE for life? So Catherine, as Sonali had said, that one-on-one consultation is the best way for you to be able to know your situation. So Sonali, if at some point we can put in the contact information or that the hours, just so that everyone knows.
Sure.
For one-on-one. Great.
I already posted on the comment what the hours are, and I'll post the phone number as well again.
Great, thank you. That was Jay coming in, also from HSS. All right, so Nataza said, are Medicare retirees eligible to participate in FSA or long-term disability insurance?
No, we do not offer voluntary benefits to retirees. They can the only benefits that we offer are health, dental, and vision for retirees.
Okay, that's great. Good to know. I'm going to refresh our comments. and see who's up next. So Kylie. Kylie says, I'm the retiree and my spouse is the dependent. We have Kaiser. If I understand correctly, I'll move to a Medicare plan and my spouse will stay on the existing Kaiser plan until Medicare are eligible. Is that correct? That may be an HSS.
Yes, can you repeat that one more time, Holly, if you don't mind?
Yeah, Kylie's asking, Kylie is the retiree and their spouse is a dependent, and they have Kaiser. So will they move to a Medicare plan and my spouse will stay on the existing Kaiser plan until Medicare eligible?
Yes. So so Kylie is a retiree, so she and is Medicare eligible. Then she'll continue on the Medicare eligible plan, and the spouse will be on a Kaiser HMO plan till they become Medicare eligible. And when they do, they will be transitioned onto the Kaiser Senior Advantage plan along with the member.
Okay, great. Thank you, Sonali. The next question comes from Tom, and Tom's asking, who is the Blue Shield provider for online pharmacy?
It is Amazon Pharmacy. They can call our customer service and they can definitely get you connected over to them, but it is done through Amazon Prime.
Okay, thank you, Laura.
You're welcome.
And our next question is from Linda Gaspard Berry. Linda says, I turned 65 in February. Does Medicare start covering me in January? That might be for Sonali. It's a general retiree question.
So what's the question again? 65 in January?
Linda turned 65 in February. And so Linda's asking, does Medicare start covering her in January?
It would be from February 1st of the birth month, or if the birth month is February, then it would be February 1st, effective February 1st.
And Sonali, you had given some information too about how to prepare so that it's not just automatic. Can you maybe share that too, just so that Linda knows the steps to get there?
Sure. Linda would have to go 3 months in advance and apply at Social Security Administration. It takes at least 3 months for Medicare processing, and provide us, like if the birth month is February, then we would request that she provides us either the copy of the Medicare card or the award letter by the 15th of January.
Okay, very informative. Thank you. The next question comes from Raban San Miguel, and Raban is saying, can Laura actually repeat the pharmacy options for Blue Shield? Which pharmacies allow for home delivery of discounted copay for 3 months? So Laura, I'll
We strictly, sorry about that, didn't mean to cut you off there. We strictly work with Amazon Pharmacy for the online home delivery program. So we work directly with Amazon for that.
Great. It's one to go to. All right. Next question is from Irene. What is the copay when we visit a primary care doctor and a specialist under Blue Shield Medicare PPO? That's for you, Laura.
That is a $0 copay.
Okay. Quick answer. All right. The next question is from Elaine Pon. I am an active employee covering a retiree city employee who is over 65 and on Medicare. How does this work? We are on Blue Shield. This might be a combination of Sonali knowing, how retirees and dependents work together in our benefits, and then Blue Shield if we can support it anyway. So Sonali, I'll read the question again. I'm an active city employee covering a retiree city employee who is over 65 on Medicare. And so wanting to know a little bit more about how that health benefit works. And they're both with Blue Shield.
Okay. As long as the member asking the question is an active, remains active employee, they can cover the retiree employee without the retiree employee having to enroll in Medicare. But once the member decides to retire, and if they are and if they are below 65, it can they can transition onto the retiree coverage. But then the dependent would have to enroll in Medicare Part A and Part B because they are above 65. And when this primary subscriber turns 65, they would have to also enroll in Medicare Part A and Part B. So essentially, it's required and mandatory for all SFHSS retirees to be enrolled in Medicare and Medicare Part A and Part B when they turn 65.
Okay. All right, our next question comes. Oh, Jessica.
Hi, Holly.
Also
This
HSS
is Jessica.
staff.
I do want to clarify a previous question from a member who asked about the cost for Blue Shield Medicare copay to see their primary care versus a specialist. It's actually a $5 copay to see your primary care and $15 copay to see your specialist. And you can find that.
Yes, sorry, Jessica. I was going to correct myself on that when I got a chance. I'm so sorry.
No worries. Jay, would you mind dropping in the guide link to the guide that has the cost spelled out
Sure, got it.
for the retirees? Thank you.
Yeah, and I think if we put it in the comment, then it'll be corrected and documented, archived. So we'll keep moving on. All right, so the next question comes from MW. Do we still have the VSP if we move the KP senior to KP Senior Advantage plans?
Yes. So vision benefits is bundled with medical. For the basic vision, the premiums are bundled within the medical, but if you choose to do a vision buy-up, then there is a premium for that. But for the basic, which is bundled with medical, if you just enroll in medical, you get the basic as a default.
Okay, thank you, Sonali. The next question is from Linda Acosta. Is there a way to connect with previous retirees to ask about their experience of Kaiser versus Blue Shield for the retiree options? Or is there a forum or reviews posted anywhere? So that's an administrator side of the question. So if HSS staff, do we have any place for retirees to exchange recommendations or reviews? And I might defer to Jessica Shi, our communications director, just to if there's any pathways that our previous retirees can share their experience about Kaiser versus Blue Shield for retirees, or is there a forum or reviews posted anywhere?
I don't know about a forum, but the retired employees of the city and county of San Francisco, known as RECCSF, they have members who are on both the Kaiser or the Blue Shield Medicare plans. And I think if you reach out to that organization, they would be able to put you in touch with some members who have experience with both those plans. And there are other organizations like the retired police officers, retired firefighters, but the retired employees of City and County of San Francisco, known as RECCSF, is a general organization, not specific to previous employment. And so you can certainly ask them. And I can drop the website.
Okay, thank you,
for
Jessica.
RECCSF.
Okay, our next question comes from Roban in San Miguel. I think there's a little bit of clarification. So Roban is saying he thought he heard that Blue Shield worked with a list of pharmacies where one could get 3 months of medication for a 2 months copay. And Roban had wrote down Safeway was an option. So Laura and maybe Julie, I'm not sure if there's different options, but I'll go with Julie, Laura first to respond.
Certainly, it would be our preferred pharmacies that would allow you to receive up to 100-day supply for a 2-month copay. To get the list of those providers in your area, you can go to our blueshieldca.com/SFHSS, and it does have the most current list of our preferred pharmacies for your area, and that is where you would be allowed to get that. I just can't guarantee that they would deliver them to your home like Amazon does, but you can definitely save that copay with a preferred pharmacy.
Okay, thanks, Laura, for that clarification. The next comment actually comes from another staff member here at HSS. William Kudnoff, who's supplementing a little bit of information, saying regarding the out-of-state chiropractic network for the Blue Shield Medicare PPO plan, retirees who reside outside of California, those members should contact the Blue Shield customer service at a number we've provided, 800-370-8852, for assistance in finding the network chiropractic provider in those individual states. And then ASH, the American Specialty Health program, does not administer outside of California. So for the Blue Shield of California Medicare plan, PPO plan, that was a little bit more information. And we'll go to our next question from Elena. I am a retiree under SFHSS. My husband is a retiree under the federal government and opted out of Medicare B at retirement. So the question is, can I pick him up as a dependent, and how would I handle the Medicare B issue?
We would need the Medicare Part B enrollment. It's mandatory to enroll in Medicare Part A and Part B. They can check with Social Security if they can still get the Part B, but it is a requirement to enroll any dependents or members into SFHSS plans.
Okay, thanks for the clarification. The next question is,
can I elaborate on that?
Yeah, Jessica, go ahead.
If your husband opted out, did not elect Part B when he became eligible, there may be a penalty for enrollment. Julie, correct me if I'm wrong. But
yeah, you are correct. I know that some federal employees, they're not required to get Part B under the federal health plan, but if they are choosing to enroll in Part B later, they could have a penalty of 10% for each 12-month period they waived coverage. And so he could probably reach out to Social Security during the general enrollment period, which is January 1st to March 31st. If he's missed his initial enrollment period and doesn't have any other special enrollment period. So he should definitely contact Social Security to get the details on the process and then any potential penalties.
Thank you.
Mm-hmm.
Thanks, Julie. And then, within this question too, Elena is asking, can I pick him up as a dependent? And Julie had mentioned a certain time frame, but for HSS, is there a certain time frame that Elena could pick him up as a dependent, the spouse?
During open enrollment.
Yeah. Now is the time.
And then
but again, it's contingent on having Medicare Part A and Part B. If there is no Part B enrollment, then there is no eligibility.
Great. Thanks, everyone, for clarifying. All right, the next question comes from Leslie Lum. I'm currently enrolled in BSMA. My PCP, my primary care provider from a previous plan, is in a group outside of the Blue Shield network. Can I still see him?
The answer is yes. With the Blue Shield PPO, you have freedom of choice. You can use any provider that you would like to see as long as they accept Medicare. That's the only caveat that we have. Once that you see that provider, they should submit the bill for you. If not, you can contact our customer service and they can walk you through that process of submitting the bill for you, or that you can go ahead and submit that bill to us. But again, yes, you definitely can see a provider that is not in our network with Blue Shield of California.
Okay, thanks, Laura. The next question is coming as a follow-up from Catherine Kong Orban. And Catherine is saying that they're willing to fly in to come in to see an appointment because we had said that the office is open because Catherine lives in Las Vegas. So Sonali, could you reiterate, is it a must to come into the office, or can there be phone consultations?
Definitely, there can be phone consultation, and I highly encourage that. But unfortunately, at this time, we are not servicing via appointments. We are open to walk-ins. Again, the hours are 9 to 4:30, and on Thursdays, we open at 10.
Okay, so no appointments needed, but someone can call the phone line at any time and wait for a health member services member to speak with on the phone.
Absolutely, yes.
Okay. Great.
And then could I just jump in on a statement? So I think this is the person that's been asking about TRICARE for Life and then San Francisco health coverage. So Medicare does not allow somebody to have more than one Medicare coverage at the same time. So if they have TRICARE and are looking at TRICARE for life, then they wouldn't be eligible to go into one of the San Francisco health plans because San Francisco requires that Part B coverage, and their TRICARE for life, they've assigned their Part B to that. So they might also want to talk with uh, the federal government or whomever is overseeing TRICARE, but they're going to need to make a decision between remaining in TRICARE or enrolling in San Francisco health coverage.
Thanks, Julie.
Mhm.
There's a lot of requirements, and we're trying to make sure we
Yep.
get all the information out to everyone. All right, our next question comes from Ellen Pon, who's asking, do we need an appointment for a walk-in?
No. So there is a little bit of a wait time because we're going through open enrollment, but there's no appointment needed for walk-in.
Great, thanks, Nellie. The next question comes from Margarita Racinos. Can both VSP and Kaiser Vision 2020 services be used, and how are they coordinated?
The Kaiser Medicare Advantage plan, there are no vision hardware benefits. There is not like a eyewear or contact lens allowance. You can see a Kaiser eye doctor, but Kaiser doesn't coordinate with other vision benefits in that way. So it would be separate. If you're going to maintain your VSP, you can use that with VSP providers.
Okay, thanks, Julie. All right, and our next question is coming from Catherine, who we know may need to be calling in and getting some personalized questions answered, but is asking for the phone number for our office. So that is something we can drop in a comment, but Sonali, if you could share that as well.
Sure, it's 628-652-4700.
Okay, great.
I also just dropped it in the comment box. Thank you.
Thank you, Jay, another staff member here at HSS. So we are about 10 minutes before our end time, and I know our staff is publishing all of our questions as they come in. It doesn't look like there's any new ones right now. We can hold on for just a few more minutes if any questions come to mind for anyone. And while we're doing that, our staff can also drop in any other resources, our main webpage to get all of our information regarding open enrollment. So we've got resources after the webinar as well.
Holly, this is Jessica. I'm monitoring, and there are no new questions coming in. Oh, hang on. Catherine has a question regarding the phone number again.
Yeah, we can repeat that, Sonali, just slowly. Maybe we'll do it twice just so it gets enough time. Yeah.
It's 628-652-4700.
Okay, one more time, just in case.
Okay, 628-652-4700.
And that is in a chat, so we can also find it that way. All right. We have a question coming in from Linda Acosta. I don't think my earlier was answered, but what are the implications for someone retiring under 65? So Sonali, maybe a general overview. What are the options for someone retiring under 65?
The benefit offerings are same as that of an active employee, the same Blue Shield Trio, Blue Shield Access, Kaiser HMO, HealthNet, Canopy, and Blue Shield PPO. Once they turn 65 or about to turn 65, as I said, 3 months in advance, they need to apply for Medicare Part A and Part B, and then provide us that Medicare confirmation of having enrolled, and then they get transitioned onto the Medicare Advantage plan. Either if they're in Kaiser, they get defaulted into the Kaiser Senior Advantage. If they are in the Blue Shield plans, then they get defaulted into the Blue Shield Medicare Advantage plan.
Okay. Thank you. And Ellen Pond, who had a question earlier, is seeking clarification. So Ellen is the active employee covering a retiree, and she's wondering if the dependent if it has to be on Medicare, or is it or is it mandatory?
It is. It is mandatory to have Medicare Part A and Part B when dependent or the member turns 65 and are a retiree.
Can I clarify?
Yes, please, Jessica, go ahead.
Ellen, if Ellen is an active employee, if your dependent is your married spouse, they can be on your benefit. So whatever you're on, let's say it's Blue Shield Trio or HealthNet, they can be a dependent under the same plan. If they are your domestic partner, they would have to enroll in Medicare. If they are eligible for Medicare, they must enroll in Medicare. And then they can select one of the Medicare plans, which also means that you would be limited. Because let's say if you are on HealthNet, then you have to move to one of the Blue Shield plans, let's say Trio, in order for your partner to be on the Blue Shield Medicare plan. Or you can be in Kaiser, and then your domestic partner can be in Kaiser Senior Advantage. So Sonali, correct me if that's your understanding.
That is correct. I missed the part that the member was active. Everything you said is correct.
Okay, thank you, HSS staff. We've got about 6 minutes left, and I can see 2 questions have come in. So Joseph Mayer is saying, what dementia care options do the different plans provide? So Julie, I'll let you go first for this one.
So I think that's a pretty broad question in terms of dementia options. We would cover any type of diagnostic tests and then any medical treatment related to whatever the specific situation is. Then Medicare would cover home health services if those are needed. So I think you need to see what the more specific diagnosis is, and then we would be covering any treatment related to that. And I think the EOC, which should be available on the HSS website, and I can pop it into the chat. The evidence of coverage is a very large, gives you a document that gives you an overall what exactly is covered by your plan. So we'll drop that in the chat there.
Okay, thanks, Julie. And Laura, for Blue Shield options?
I'm going to actually mimic Julie's answer. There is a wide variety of different diagnostic procedures that can be done, therapy services, everything else. Again, will follow what we cover as far as Medicare approved services. Unfortunately, our EOC is not out there yet. It's coming, but our summary benefits, which does give you a high level overview, is out there on the website. But again, any specifics definitely is out there in the evidence of coverage, or you can contact our customer care center and they can assist you with direct questions about specific care and see what coverage is available for you.
Okay, thanks, Laura. And the next question is, when we get the Medicare approval letter, do we mail it or fax it in to HSS?
Either you can mail it or fax it, and we accept only copies, so no originals. And the fax number is 628-652-4701.
Okay, that'd be great to pop into the comment too. Just
I
so
am.
that we have.
Yeah.
Great, thank you, Sonali. All right. I'm not sure if we'll be able to answer this question. It's part of maybe a larger one. This is from Kay Lamont. Can you only have Part A?
No. Again, we need Part A and Part B. It's both are required.
Okay, great. Thank you. The next question comes from Tom. This is a general question. There's no open enrollment booklet received in the mail this year. Is there anything that's going to be going, or is everything going to be online going forward?
Yes,
Jessica,
our materials are online. And if there are specific things that you may need, like if you don't have access to online, I believe our member services representative can send you rate sheets and plan comparison charts if you call.
Okay, thanks, Jessica. Because Linda Gaspard-Berry is asking the same thing or similar. Will we get any printed material information regarding the two different Medicare plans?
We will not be mailing, we did not mail it to you as part of your open enrollment packet this year. If you do not have access to the internet, please call our member services and let them know what you're looking, if you want to do a plan comparison. I think we do have that, correct, Sonali? That sheet where it lists the different Medicare, like
Yes,
Chiral
and it's
Act. Yeah.
available online as well on our website, which is sfhss.org.
Yeah. Jay, can you put the link in?
I'm doing it now.
Thank you.
Great, thank you. And we have a follow-up question from Ellen Pond. So to Jessica, if you could repeat the information about the domestic partner. Ellen says that I am on the Blue Shield HMO Plus access.
Okay, got it.
Access Plus.
So you are an active employee on Blue Shield Access Plus HMO and you have a domestic partner, then your domestic partner needs to apply for Medicare, which I know takes some time. But they need to apply for Medicare, submit the Medicare information to SFHSS member services, and then they can have the Blue Shield Medicare PPO plan. That we only have two Medicare plans. It's either the Blue Shield plan or the Kaiser plan. But since you have Blue Shield, it makes sense that they go on to the Blue Shield Medicare PPO plan.
All right, thank you, Jessica. And we're just 1 minute away from the top of the hour. We want to thank everyone for joining us today. Resources are going to be available online on our webpage. And Jay can also drop that information to route everyone to our online resources. So thank you, everyone. And we hope you have a wonderful open enrollment.
Thank you.